Thank you for joining me today. My name is Debbie with Vibration Guide, and this is installment number 4 of whole body vibration for fat disorders. There's a lot of different fat disorders. This month is Lipedema Awareness Month, so we've had a bit of a focus to support that community and share some awareness. My area of expertise is whole body vibration machines and their applications. I have over a decade of experience, anything from fitness to medical, everything in between. And what I can say is this is a technology that you need to explore. You need to understand. If you've had a bad experience, 9 times out of 10, it's a bad demonstration or a poorly designed machine. I'm going to get into some specifics today, and we're going to start addressing each of the questions that you were kind enough to share with us this week. Thank you for joining us today. So question number 1, starting with the basics. What is whole body vibration and why should I do it? Whole body vibration, without getting too scientific and technical, because it is a big topic, there's a lot of benefits that you will see on the street. I like to classify it as an easy, passive form of movement. It can be exercise. Exercise, just like on the floor, really depends more on you physically, what you're able to do. Perhaps you're dealing with limited range of motion, fatigue, pain. I think these are things that probably resonate with most of you. Whole body vibration, depending on the style of machine, and I will get into that in a later question, but is an ultra low impact movement. And the premise behind whole body vibration, and I try to describe it as this: don't think of it as a machine. It's not another exercise machine. Think of whole body vibration as an environment. And in this environment, it allows you to perform traditional floor exercises, stretching, standing, anything that you may be doing, in a weight bearing manner in this environment will produce more effect in less time with less effort to you as the user. So that's the very simple explanation. A little deeper, essentially what it is it's a hyper gravitational environment, and our body builds our bones and our muscles based on our relationship with gravity as we're standing or walking around on this planet. And when we sit too much, when we're inactive, our muscle strength, our bone density, these things digress because we're not interacting or we're not bearing weight within that gravitational environment, the earth. Our relationship with the earth is 1G of force, and we don't feel it, but we're constantly resisting that 1G that is pulling us and keeping us grounded on the floor. A vibration machine superficially increases your exposure to gravity through micro little movements. And some machines are capable of 30 to 40 times the amount of gravity. And this isn't a harmful thing like where you're deep sea diving and the pressure of water is going to crush you. What happens in a vibration machine, unlike a car, unlike an airplane, where when you hit the gas, that feeling, that's G-force, you feel the G's. You'll hear race car drivers talk in that manner. On a vibration machine, there is a thrust, and depending on the type of machine, if you're standing on a machine, it's either going to move you upwards or side to side. And the push is when you're exposed to that increase in gravity, and a split second later it drops, or you're unexposed to that gravity and there's a free fall. So unlike a car or a truck where acceleration is in one direction, you're moving forward or you're moving backwards, on a vibration machine, all that increase in gravity is going to do is in that split second, depending on the level of G-force that you're working with, it's going to cause a muscle twitch. It's going to cause a reaction in your muscles, and it's going to cause them to work harder. On most machines, we're talking movement of millimeters. So it's not even as much impact as walking across the floor. So knowing that we're increasing muscular activity in a short period, that there's reasons. We're going to talk a little bit more about duration now when we get to the in-depth use. But using a machine kind of makes sense. If all you're able to do is stand or sit in a chair and expose your legs to it, you can effectively get more done on a vibration machine in less time. And it's a huge advantage when you're dealing with mobility, pain, fatigue. The last thing you want to do when you have no energy and you're in pain is work out for a half an hour and be done for the day. So we'll talk about durations and position outlines in upcoming questions. Some of the benefits associated with whole body vibration, and probably one of the bigger ones for the fat disorders community, is lymph and circulation. You are inundated with products and medical advice about how you've got to move that lymph, you've got to increase circulation, and quite simply, when we move, lymph moves. Circulation and blood flows throughout our body with a pump, which is simply our heart. But with our lymphatic system, it moves through activity. You've seen Dr. Hurst talk about in last week's video, you just wave your arms. With a vibration machine, that the premise is very simple. It's not about what I want you to do or what the manufacturer making the machine wants you to do. It's about what you're able to do. So most people would be able to stand on it in a basic manner, like I say, put your feet on it in a chair and accomplish the very bare minimum of that lymph and circulation, which is a critical thing for those of you, especially dealing with less mobility and spending more time sitting. Bone density is another big area of concern. Doesn't matter if you got lipedema or Derkums. Bone density is a concern for everyone. We're living in a toxic world. We're less active than we ever have been, and bone density is decreasing. Bone density, to get back to my little gravity explanation, bone density increases when we use our bones. So bearing your weight, just by standing on the floor and bearing your weight, as long as you can and sitting back down would be a very basic starting exercise for someone that's elderly, maybe recovering or trying to, build up um, on the osteoporosis or osteopenia diagnosis. So standing and bearing our own weight is the bare minimum of building our bones. And if you're able to do more, maybe instead of standing, we're squatting a little bit, or we're working with some weights. We know that lifting weights, even of a moderate amount, is a good way to improve bone density. But sometimes on the machine, especially with this audience, you're dealing with joint pain, you're dealing with inflammation, maybe you've got arthritis on top of that. So you don't need to move on the machine. You can stand there passively, you can squat and just hold still, and you can do a lot for the bones just by bearing your own weight. And again, we're doing it in an environment that gives you more bang for your buck in less time. So bone density is one of those benefits, in my opinion, that is kind of a given. Just like circulation and lymphatic movement, it's the bare minimum that you will get from this technology. Another area of concern would be balance and stability. Great way to improve your balance and stability on these machines. Again, it's kind of a side benefit, as I refer to it. But as we're dealing with obesity, bad knees, bad hips, sometimes our balance and stability is poor. And if you are dealing with a diagnosis on my earlier point of osteoporosis or osteopenia, nobody ever died from osteoporosis. It's the falls and the break and the recovery from those situations that can be so taxing on you. So balance and stability is something that you will notice improve very quickly when you start using the machines, even in a very basic fashion. Weight loss is another big benefit. Weight loss, when you're dealing with lipedema or any fat disorder, that lymph is stagnant, it's blocked, it's hard to move. And exercise and traditional weight loss means sometimes can be a challenge. As I said earlier, it's joint pain, it's the duration. So weight loss on a vibration machine is, you can get some effects from just standing there, getting that lymph moving and circulation, but you're going to get better bang for your buck if you're putting a little effort into it, if you're able. And what I mean by that is, instead of standing there, maybe you're just squatting lightly and engaging those thigh muscles. The biggest group of muscles on our body is our thighs, and it's going to do our thighs and our glutes, and it's going to burn the most calories for us. So a lot of the weight loss exercises I'm going to be talking about later on today are simple. I want to keep things so simple that it's easily accomplished and an easy habit for you to form using these machines. But a basic squat is going to give you more on the weight loss and the strength benefits than just standing there passively. How long you squat and what that squat looks like is going to be different for everybody. So it's about moving and feeling better and progressing to these types of benefits. One other benefit I want to cover is the warming effect. And I don't know exactly what the terminology would be for this. I think many of the manufacturers refer to it as rapid heating of muscles. And in our session last week, Dr. Herbst referred to it as, it's going to liquefy and gel and warm up that fat. With a vibration machine activating so much more muscle in a shorter period, it does have a warming effect. And separate to warming and hopefully liquefying the fat, I wanted to talk about this because you guys are always cold. It's that hypothermia on the skin, the Raynaud's, all these conditions where circulation just isn't getting distributed evenly throughout our body, and we start suffering symptoms of that. So the warming effect, the rapid heating of these muscles is another big benefit. Weight loss, strength, all of that aside, but just being able to warm yourself up if the feet are cold, the legs. I live in Canada where it's seasonally it's pretty darn cold. And after I've been out snow shoveling or chasing after my kids, a lot of times I'll get on the machine just for a minute or two just to warm up, so that I can, some of you will see a benefit in that, and it's not always a big workout. I'm going to talk about the difference between a workout and a feel good or a spot treatment session a little bit later on in our other questions. The last benefit that I wanted to bring to your attention is neurological. Now, there are a much big longer list of benefits, and most machines are making big claims. Not all machines are capable of delivering all of the benefits that they claim. I will talk about that in a later question. But neurological benefits can be a huge reason to consider this technology. If you're dealing with atrophy, you're dealing with plantar fasciitis, neurological damage. Perhaps you're dealing with a condition, you've had a concussion. There's a number of reasons that our body neurologically may not be functioning properly. There's soft benefits. What happens on these machines if you're using a certain type of machine that is capable of higher G-force, you're recruiting a higher percentage of muscle fiber. I personally have worked with a number of patients that are completely paralyzed and have no feeling. Some of my diabetics in their feet, and they feel when they're on the machine, and that sensation improves with prolonged use. So the study is kind of gray right now, but my personal experience of almost 14 years, I see people neurologically improve on many different levels. It really depends on how you've been affected. Mental clarity for me is a big one. A lot of times, I got to get on a call. I've been talking all day. My brain is fuzzy. I might get on it for a minute or two just to get my mind straight. It gives me a boost of energy. A big thing that you guys are dealing with is fatigue. It's a downer having no energy all the time. You start beating yourself up, you get depressed. So if you again can start moving and feeling better, there are neurological advantages with using this technology. Maybe it's because it's over quick, it makes you feel good. Sometimes the battle when you're dealing with something like lipedema or excessive weight is it's just demotivating to go to the gym. It's going to hurt, it's going to take a long time, and there's a stigma out there. I've had a couple of you mention, that you've worked with trainers on vibration machines and had horrible experiences. So, trainers aren't necessarily experts in lipedema, and many of them are certainly not experts in whole body vibration. So I hope to bridge the gap, and if you have had a bad experience, we'll go over, some things to maybe change, and hopefully find that you'll find the advantage of this technology going forward. Outside of that, there are many other benefits that I could get into. But if there's something specific that hasn't covered those general points today, please raise those to me in a question, and I will address that in a later on session. Okay, so next question. What is the best type of vibration machine for me? There's a lot of different types of machines out there. I'm going to simplify this a little bit by speaking of two movement styles. Back in the day, with all of the science and as the science builds, there's two basic movement styles. The first is linear. Linear, the entire surface of the machine moves equally up and down. The other is oscillating or pivotal, which moves like a teeter-totter. You will find the majority of the research and probably the pioneers of whole body vibration, if I were to give them that title, would be a machine called the Galileo. The Galileo is the Cadillac of pivotal oscillating movement, but it is very expensive as a medical device. It does start in the thousands of dollars and up. The other style, the linear, you would know as your power plates. There are other versions out there, but unfortunately, there are differences between the frequencies and the specifications of how you use these machines. So sometimes it gets very confusing when you're comparing them online. And the industry has kind of gone rampant. There's 4D, there's spiral, there's sonic. Just because a machine moves more in more directions or has more bells and whistles does not necessarily mean that you are getting more benefit. There isn't a lot of science to support the combination machines, and for the purposes of today's definitions and to come from more of a place of accurate science, I will only be reviewing lineal and pivotal style platforms. I'm going to start with the most common style, which is the pivotal. So pivotal, the frequency range on pivotal will range anywhere from upwards of 30 to 35 hertz. Hertz is cycles per second. So how many times per second that machine is moving you back and forth. A very important point on frequency, regardless of the type of machine that you're using. Most machines out there state speeds or levels. Some state the actual frequency, but speeds or levels are kind of undefined. If you were to get into your car and your speedometer said it has, up to 200 speeds on the speedometer, you'd kind of be going, well, is that miles? Is that kilometers per hour? It's undefined, is what it is. So, on a vibration machine, you might have a speed range of 99 speeds, but the machine is likely only capable of about 12 to 13 hertz. The industry average, and I've tested a number of machines and owned a number of machines in my lifetime. Um, the average machine out there is probably topping out, and I'm being generous, at about 14 hertz. I'm going to break down the benefits within this. So within the oscillating style movement, there are three frequency ranges within the capabilities of this world. The really, really slow speeds, and I want to touch on this point. Many of you have said, oh, I started on a slow speed. I only went 5 for 10 minutes, and I had a horrible experience. What am I doing wrong? On these machines, we have a tendency to think, well, I'm just going to start slow, kind of like a treadmill or an elliptical where, you wouldn't go full tilt right off the bat. On a vibration machine, it's kind of a different thing. There's two factors that you control regardless of style. On a pivotal style platform, the really slow frequencies, the starting speeds, anything up to about 10 hertz, are your balance and your stability speeds. They're kind of like being on a Bosu ball or on a rebounder. And there is a lot of evidence that this range improves your balance and stability, which logically, so would standing on a Bosu ball or a wobble board. But what I find for this community specifically, sometimes the slow speeds are very choppy and very jarring. And when we get shown these machines at the gym or we try it at a trade show, we're encouraged to stand with our feet wide. We think by standing wide, we're getting the most benefit. But on a pivotal style platform, the wider you stand, the more movement or the more impact that you're subjecting your body to. So think of yourself standing wide, regardless of what frequency you might be using. Standing wide is the most movement. And if you're having a bad day, you're dealing with joint deficiencies or pain, or you've never been on a machine before, start with your feet closer to the center. That's more like scuffling or walking slowly across the floor. So just like a teeter-totter, if you're the dude at the end, you're getting the most movement. If you're in the middle, you're not getting as much movement. So start on any speed that you're experimenting with your feet in the center. And the wider you stand, the more intensity you will feel. So the next range of speeds on a pivotal platform, keeping the foot thing or the hand thing, if you're doing upper body, hands closer, will be less movement than further. The next range of frequencies into the teenagers. So anywhere from about 11 up to about 18, 19 movements per second are more about relaxation, feel good, joint mobilization. You are still getting balance and stability. Your body's stabilizing constantly while you're standing on this platform. The basics of circulation and lymph, which is critical for this audience, is kind of happening anytime that you're on the machine. As I said earlier, when you move, lymph moves. And when you're standing on this machine, regardless of what speed or where your hands or feet are, you're moving. So lymph and circulation is promoted on any frequency, but I think for most of you, if you have had a bad experience, you know, your knees were sore, you had a headache, anything that left you with a bad feeling about your first experience with a vibration machine is 9 times out of 10 how you're standing on it and what speed that you're using. So bring the feet close. Start with your feet close, get yourself grounded, and I think you'll find if you bring the speeds up a little bit, think of yourself driving on a bumpy gravel road and you're driving very slow, and you know you're bouncing all over on the seat of your truck and stuff's flying all over the dash. If you hit the gas, you still feel the bumps in the road, but you kind of skim across the top. It's not as bumpy. Same on a vibration machine. On a pivotal style, on those slow speeds, we go from kind of a wobble to more of a shake on the mid frequencies. And as a general rule, anybody who's worked with me or been on these machines for any period of time, you'll always find it more comfortable to bring your feet a little closer and get going a little faster than standing really wide and really choppy. I think that that's just a suggestion that I would make based on some of the comments I've seen. So the industry average, regardless of what machine you are purchasing, most machines out there are mirrored after the medical Galileo device, but very few actually can offer the same frequency ranges that the Galileo does. The average vibration machine being sold to date, and there's a number of consumer brands on Amazon, at Costco, of the pivotal style movement, the average frequency, and I'm going to be generous, is about 14 hertz. So, you know, most machines are going to give you some lymph circulation, some relaxation effect, but it's really only about half of what the science really was developed around behind these machines. There are a couple of brands, the Galileo, the medical device that kind of started all this. Hypervibe, another brand, I used to do training for them. Many of you use their platforms and have done training with me. Hypervibe and Galileo are capable of frequencies, you know, 25, 30, 35 hertz, almost double the average consumer machine. And why this is important, there's a lot of benefits out there that these machines are claiming, but very few of them are necessarily capable of delivering the benefits that they claim. What happens on the higher spectrum of the frequency range on the pivotal style, once you exceed about 18, 19 and beyond, when you get into those higher frequencies, it's too quick. Your body kind of loses the ability to move back and forth, and your central nervous system becomes chief and commander, and through all of your peripheral nerves, we're recruiting more muscle fiber. So the intensity of that movement is controlled by how close or how far apart your feet are. And if you are working with a high acceleration platform, a Galileo or a Hypervibe, start with your feet dead in the center. Bring the frequency up to maybe 20. That's a common speed that I'll talk about more later on, and decide on the intensity based on how you're feeling. You know, you decide the intensity with the positioning on your feet on this style of platform. So two key things that you want to understand is the actual frequency of the machine is not speed or level, that's undefined. And the amplitude of the displacement on a pivotal platform is always marked in millimeters, you know, 10 millimeters, 8 millimeters, 11. That's if you're standing on the outer edge of the plate. That's where they take the marker. Doesn't mean that you need to stand there. Again, the benefits are driven by the speed, the types of positions that you're doing, not how much shaking you're taking. And I think for a lot of my ladies that are experiencing bruising, you know, fatigue, just didn't have a good session, you're taking on more impact, and in combination with a long duration is probably it was taxing. It wasn't the best place that I would recommend you start. On the lineal side, so the vertical machines, completely different thing. So they also have frequencies, and unlike the pivotal market where things are kind of mismarked, or the marketing is misleading because they throw speeds or levels at you because it's a bigger number. In the vertical style, the frequency ranges are higher. The frequency ranges on a vertical style platform are going to range anywhere from 20 to 50, in some cases 60 hertz. But the amount of movement, the amplitude or the displacement is much less overall than a pivotal style. So these two numbers, not to get too complicated, equate to an overall G-force, and G-force and increasing our exposure to gravity in this environment. That's what I kind of think of these machines as. They're an environment that superficially increases your exposure to gravity. The G-force threshold is going to be different depending on the combination of the frequency and the amplitude or the displacement. So back to the vertical style or the lineal style, the exercise ranges, the slower frequencies, the 30, 40, upwards to 45 hertz, they are more your exercise, your relaxation. The muscles are moving back and forth at a rapid pace. But the amount of movement, the best machine in the world, the original power plate, now known as Vibrogym, where a lot of the science was developed in this style of movement, these machines are capable on a high setting of about 4 millimeters of amplitude. So every time that machine's moving you up and down, it's a fixed thing. Unlike the pivotal where you can kind of adjust that on the fly. On a vertical platform, it is a fixed setting. And if you have a machine of a vertical nature, you might have a high or a low button. That usually indicates that it's moving this much or this. It changes the amount of movement. Now back to the science, the average scientific machine, top of the line power plate in today's world, they're pushing 3 to 4 millimeters each time that plate is moving you up and down, and that's how far that muscle is contracting with each movement. Unfortunately, the downside of vertical plates, specifically for this audience, again, it's a user preference thing. In all my years as a studio owner, out of 100 people that I line up, trying the very best in both the Galileo and the Vibrogym, the two machines from science. I've had the luxury of working with both. More people prefer this. It's more how we move. There's been a number of comments about head buzz and headaches. That's typically related more so, in my experience, to vertical style platforms. It is not harmful to your brain, but as women, we tend to guard and protect and resist. And on a vertical style platform, it travels up, resonates throughout the body in a different fashion. And if you're standing quite tall, unable to bend your knees a little bit, you're going to get it all in the neck and the shoulders. And as we resist it and fight it, we become rigid and actually amplify the shaking to a degree. And if you're standing tall on either platform, you send the vibration more up to the head. If you bend your knees and you suppress further, if you're able, you'll feel the vibration suppress lower on the body. So on the back to the vertical style, in the market, the frequencies are typically accurate. If you're looking online and it says, this machine has a frequency range of 30 to 50, you can usually bank on that being effective and accurate. But it's the amount of movement or the displacement that's kind of been watered down in consumerism since these machines have come over. Back in the 90s, when the economy was good and these big machines were coming over from Germany, they didn't put them into the hands of people like Dr. Herbst or Linda Ann Kahn, people that had a clue about the body. They threw them into shopping malls and they threw them into trade shows, and you'd walk right up to it and crank it up and whoo, you get all this head buzz because nobody told you just bend your knees a bit. Or if you can't bend your knees a bit, let's sit you in a chair and just start with the legs. So there's a way to start any new activity. And the common thing with a vertical style platform that people experience is a lot of vibration in the head. And it's just the nature of the machine. Again, there is some evidence, again, manufacturers battling it out. This is better than that. And a lot of the pivotal manufacturers talk about the excessive vibration on a vertical platform. It's absolutely true. And it's one of those things you can either tolerate it or you can't. So what they've done in the market is they've reduced that amount of movement to make it more consumer friendly, more comfortable. But in doing that, unless you're investing in the top of the line power plate to the tune of about, oh my gosh, probably 10 to 15,000 US, depending on where you're looking, every other model within their lineup, the displacement reduces. By the time you get to the personal power plate, it's cute, it's affordable. I want something little that fits under my desk. Understand, a little machine is not going to offer the same amount of juice that the big $15,000 machine does. The frequency may be accurate, but again, this has been watered down to less than a millimeter. And the size and the intensity of those muscle contractions has really been reduced. So G-force is a combination of the frequency and the amplitude that you're using. So the average vertical platform falls well below the threshold of where the science created a lot of the benefits. And you're going to get feel-good effects, you're going to get that lymph, that circulation, but you're not going to get a lot of the big benefits that have been advertised in some cases with these machines. So the science versus sales on machine types, again, lineal, pivotal. Those are the two basic types. There's a ton of science to support both. In this trainer's opinion, it's more about what feels best to you. I like how this feels. I like how that feels. The positions that you do on a machine are more about what you're able to do and what feels good to you, but they would be universal on either machine. It's the settings, the frequencies, the amplitudes and the displacements that really is where you get into tailoring it for you and understanding what benefits a machine is actually capable of delivering. So if someone is making a claim, common sense applies. If it's a $200 to $300 machine on Amazon, I'm not saying you're not getting some benefits, but no, they will be limited. Not necessarily outlined accurately in those ads. Everybody's promoting vibration and attaching studies, but nobody is really looking at the meat and within these studies. What type of platform was it? What were the frequencies used? What were the positions and the durations? Some of those things are not able to be accomplished by every machine on the market. Um, Other types, the sonics, the spirals, a lot of the machines that have come out of China, not unlike the Gucci purse, have been recreated. And in my opinion, a lot of the machines that are being sold mass market are just good engineering gone wrong in China. When you take a $15,000 German medical device with German bearings and components and you start swapping it out with plastics, and the energy is watered down, and sometimes these combination movements were created. And in China, well, it moves three ways. Well, it's a spiral and it's going to give you more benefits because it moves more ways. But there's really, it's hard to get to the meat of the science, and a lot of it you're going to find just doesn't exist. So I speak only of lineal and pivotal. I will get into higher G-force and the difference between those. In the vibration machine world market on the pivotal side, outside of Galileo and another brand called Hypervibe, again, I want to stress most machines are not capable of all of the neurological benefits. So please just keep that in mind when you're price comparing. You're not getting more because you're spending $1,000. In the vibration machine world on the pivotal side, unless you're prepared to invest about $1,000, any machine out there is going to offer similar benefits. It's just a matter of quality of construction and what the warranty looks like. On the vertical style or the lineal style, same kind of picture. Unfortunately, there's less options unless you are prepared to invest seven, eight, $9,000. Most of the vertical technology out there is a feel good. I wouldn't be investing more than $300 to $500 on the average machine out there unless you're stepping up to some of the bigger models. You're not getting more benefit, and you're certainly not getting more performance. What are the contraindications of whole body vibration? Contraindications used to be a really long list, and over the years, I've seen that list dwindle further and further. And I want the mentality of what are the contraindications or precautions for whole body vibration to kind of be thrown in the garbage. And I would pose the question, what are the contraindications to being active? Because they're the same darn thing. There's going to be a few things that I would proceed with caution. I'm going to outline those today. But as it stands today, the list of contraindications for whole body vibration are few, and most of them are yes, but. So even though you might have a contraindication, with modification in how you're using a platform, 99% of the time, you can still use it and gain benefit until you are in a position or until that contraindication is maybe not a problem anymore. So one of the first ones I want to bring up is a big question that many of you raised this week: metal implants. And I'm going to expand. It's not just metal implants. Anything that has been implanted into your body, whether it's a pacemaker, a screw, a rod, a mesh. There's a variety of medical procedures that will insert something into your body, joint replacements. So depending on your body and how you recover from whatever you have had implanted in your body. So let's use a hip replacement as an example. A hip replacement, typically I would recommend probably 3 to 6 months post-op, depending on how your recovery has gone. And to be honest, depending on the kind of condition you were in before you got the hip replacement. I have had clients with double knee replacements back on their machine within 3 to 4 weeks post-surgery, but they were conditioned and using the machine prior to the activity. For the lipedema crowd, if you are dealing with recent implants. So last week you had a joint replacement, or 2 weeks ago you had a fracture and you had some screws applied. The same rules would apply if your doctor does not want you doing regular activity versus your doctor has okayed you to resume activity. So as soon as your doctor has said, okay, you can go about your regular day to day, you can bear weight, you can walk to the bathroom on your own and to the refrigerator, you are okay to use a vibration machine. If you have had complications in your recovery, if you are dealing with multiple medical issues, chronic pain, inflammation, above and beyond those concerns, there's ways that you can modify use, which I will discuss in a later session today. But it is absolutely okay to use a machine if you have implants. I will also comment a little bit further if you're using linear machines or a proper pivotal machine with higher frequencies. Sometimes, quite frankly, people tell me that they feel the implant, and this is not a bad thing. I just want you to be aware of it. Very commonly, a metal implant in your body is not the same as your bone or your tissue. And as the vibration travels through that area, you kind of feel the resonance vibration. And some people find it actually feels good. But some people are concerned because, it feels like the machine is pointing out where your screw is. And I just want you to know it's absolutely a normal thing. But if you don't understand, kind of how simple it is and it's just a nature of the machine, there's no harm. It's just something I want you to understand. If those implants are recent or you've had complications and your doctor has asked you not to bear weight, not to resume your activities, depending on where you've had the implant or where you've had surgery, there may be ways. If you're using a machine now, you'll want to use it. You like the energy, the mood boost it gives you, and you miss it. So perhaps seated in a chair or sitting on the machine yourself if it's something you've had in the lower body. There are ways with proper guidance and understanding of which platform that you're using that you can use. I actually have a number of ladies that will use the machine right after lipedema, or pardon me, right after liposurgery. It is not something that I advise to everyone. There are certain settings on the machine, but there has been some evidence in my experience of it mitigating the development of scar tissue or reducing it and accelerating the healing and recovery effects. That would be something that I would want to guide you on personally, or your care provider. But there, research is ever growing, and I look forward to this someday being, the first thing they're going to put you on in the recovery room. We're not there yet, but if you do have a machine and you've had some recent surgery and you're kind of not sure, with whether that implant is able to be on the machine or not, use your guidelines based on what your therapist or your doctor is providing. If you're okay to resume activities, you're fine to use the machine. If you're not okay to resume those activities, modifications may be required. Recent fractures, I mentioned that briefly. I kind of hope this is a logical thing. If you've recently fractured a bone in your body, I certainly hope you wouldn't be going for a jog either. A vibration machine doesn't fracture the bone further or make it worse, but it's probably going to hurt. You've got an increase in circulation, you're swelling, you've got inflammation there. So if you are suffering a recent fracture, same rules apply. Are you able to bear weight? Are you waiting for surgery? There may be modifications that you can do to use the machine, but generally speaking, if you've fallen off your bike and something feels broken today, talk to me or talk to your care provider before you go ahead and resume on your vibration machine. That would also apply, sometimes you have a fall and you have a really bad bruise, or you're having pain in a particular area of your body. It doesn't mean you shouldn't do anything, but you may need to modify just based on how you're feeling. And I know with this group, we have good days and we have bad days. So there's going to be days where you feel and you want to do more, and there's going to be days where things hurt and you're going to be able to do less. But I do still encourage to try and interact with your equipment minimally for those basic benefits of the lymph and the circulation and that stuff we talked about. Acute inflammatory conditions. So inflammation. A lot of you are going to have inflammation in your body. Do you stop exercising when you have inflammation? When you have acute inflammation, especially, I'll give you an example. Rheumatoid arthritis used to be a big no-no on vibration machines. You can't use a machine if you have rheumatoid arthritis. But folks with rheumatoid arthritis aren't always dealing with inflammation. Inflammation might look like puffiness or redness on the joints, and sometimes it's hard to decipher whether that's just my regular Durkheim's or lipedema stuff, or if that's something else. So if you have known inflammation, you're going through something. Again, I prefer that you still use the machine to a degree to get that lymph circulation and help with some of the recovery aspects. But if you are dealing with inflammation, sorry, I want you to reduce the intensity and back off on the big workout until you're feeling better. If you're a regular exercise guru, this inflammation isn't always one of those things to push through. You can be active, but I would recommend not just on a vibration machine, but on your activities in general, just back things down a little bit if you are dealing with a period of inflammation or excessive swelling due to inflammation. The last thing that I'm going to put on my list for contraindications, and you will see contraindications vary depending on what manufacturer site that you're looking at, is pregnancy. Pregnancy kind of bugs me. I'll be honest with you. I have a different level of comfort and experience, but nobody wants to be, putting a pregnant woman and her unborn child in a guinea pig situation. So, in general, you're not going to find a lot of research on pregnant women when it comes to, vibration machines, let alone, treadmills or ellipticals or other things. The precaution with pregnancy is just like fitness. It really depends on you and your pregnancy. Are you having difficulties? Is it your sixth kid and you average 10 minutes in labor? Myself personally, I judge everything first kid, second kid, because my son is 16 and I was kind of just getting into the machines and was clueless and didn't have the experience that I do. My daughter, who is now 9, she's been on this thing since she was an embryo. Through my entire pregnancy, I trained. If I was a triathlete and I like to run and bike, my doctor wouldn't say, stop doing those things. You're pregnant. You can't go for a bike ride. You can't run. But because vibration machines, there's this mentality of vibration being a harmful thing. And I'm going to expand on that as my last point. Occupational therapy. If you are pregnant, and I wouldn't recommend getting into the vibration machine world right off the bat. I'm raising this point because many of you maybe have been using a machine like me for some period of time and you become pregnant and in fear you stop using it and you start feeling like crap, your energy and you're swelling. So if you are looking at using a vibration machine throughout your pregnancy or are entertaining it, there may be modifications required. This isn't something I recommend, but based on your own experience and perhaps if we have a personal relationship, just like your therapist, everyone's going to be a little bit different and what they advise for activities during pregnancy or what to avoid during pregnancy should be adhered to on the vibration machine. So if your doctor says, hey, you know what, you're in good shape, no problem, go about your day-to-day activities, logically that would include a vibration machine as well. But if your doctor has said, you know what, there's concerns, you've got medical reasons to be less active during your pregnancy, I would want to have a further discussion with you and perhaps modify or rule out using the vibration machine with any real veracity on the exercise front. So that's my piece on the pregnancy. Vibration in general, there's a lot of confusion. There's a lot of information, and sometimes we don't remember where we read it. I tend to read credible sources, so usually things coming out of my mouth, I've done my own homework on, but it's not always in front of me when I want to reference it to someone. But with vibration, there is a lot of information on the internet about occupational vibration exposure, which is a completely different thing than a vibration machine. Occupational vibration exposure is going to be posted in any workplace lunchroom, and it's the only legislation that kind of exists for use and safety around vibration. Vibration in the occupational world is things, big yellow things with four wheels like dump trucks and equipment like tampers and jackhammers where you're working at very, very high frequencies, typically 400 or 500 hertz for 8 to 9 hours a day, or you're a truck driver and you're bouncing in your seat and that spine's taking impact as you drive down the road. Some of these truck drivers have millions of miles under their belt by the time they retire. So occupational vibration concerns is about long, excessive durations where you're exposed to it for 40 hours a week, 50, 60 years of your life. You start getting, sometimes carpal tunnel or white finger or, spinal fractures and concerns. I've seen some pretty harsh issues where guys are working with a lot of industrial equipment. As I explained earlier in a question, vibration machines have nothing to do with occupational therapy, but because it's the only legislation that exists, we kind of get lumped into it. And you know, in the lipedema world, in the Durkheim's disease world, in the fat disorders world, where nothing exists, you get lumped into to wrong things all the time. So with a vibration machine, it is a completely different thing. We're talking exposures of 2 to 3 minutes, you know, for some of my clients, you know, certainly probably no more than 20 minutes a day in most cases. Some are using it every other day. You know, I don't like to put too many boxes on limits. We'll talk about that a little bit later, but the exposure on a vibration machine and how it interacts with your body from the frequencies and the amplitudes we'll discuss sooner or in the next question is a completely different thing than occupational therapy. So I just kind of wanted any of the stuff that you might see from other equipment suppliers or sometimes even doctors and therapists. The only reference information, if you go looking for the safety of vibration on vibration machines, you're going to get inundated with probably about 5-10 pages of occupational stuff before you even get to the vibration machine stuff. So just something to keep in the back of your mind when you're looking at this information online, and especially if you've been given any negative information. I just wanted you to understand where that's coming from. If there's any contraindications or medical specific stuff, to me, it's not about lipedema. It's not about fibrosis. It's generally the symptoms that you have, and if there is something that you're dealing with, gall and kidney stones is something that is a, you know, pre-indicated. If you have them and they hurt, don't use the machine. If you have them and you're still running and going to the gym, the vibration machine is going to be fine. So if there's any gray areas I haven't covered today, or anything I haven't talked about at all that you've been told is a contraindication, I'm happy to clarify that. Please post a comment in the feed today, and I'll answer that one for everybody. How long and how often should I use my vibration machine? What kind of positions should I do? A lot of questions that I got from you this week were use related. Maybe you have a vibration machine, maybe you have access to one, or you're considering. And I'm going to try and simplify this as much as I can, but I would like to first, I just want everyone to understand that, you know, asking what is the best program for lipedema on a vibration machine would be very much like going to the gym. And if you ask 3 separate trainers what would be the best program for lipedema, you're going to get 3 completely different answers based on what the trainer may like and what your body type is like, and maybe there's exercises you're restricted from doing. So to simplify, a vibration machine, again, is not a machine. It is an environment. You can perform exercise positions on the machine if you are able. If you are not performing exercise positions, things like squats, lunges, push-ups, I don't recommend starting out on a vibration machine. And if you are starting out on a vibration machine, there's a period of just getting used to it before we maybe get into the dynamics of actual exercise. So there's 2 ways that you can use your machine when we talk about the how often and how frequent. There's a feel-good session or a spot treatment, and there's going to be fitness or exercise related. And whether you are doing exercise now or not is really going to determine whether you're going to progress and want to do something on a vibration machine. So again, one of the advantages of this machine is if you are unable to exercise in the traditional fashion due to impact, you know, fatigue, medical concerns, a vibration machine will offer more results in less time, and that's one of the premises of why it's something that you should consider if you are dealing with a painful fat disorder. So I'm going to first cover feel good. Now, the mentality out there is 3 times a week for 10 minutes. I just stand on this machine, and it would probably look, I'm working on a pivotal style today, but most people stand on it really wide, really tall. You can hear it in my voice. Everything, whether you have excess or not, is shaking. So this is what we see at the trade show. This is what we see at the mall. And if you're just getting off the couch for the first time, there's benefit to just standing versus sitting. On a vibration machine, you know, one of the tips to have a better ride on your machine is bend the knees a little bit. If you're unable to bend your knees and you have to stand on this platform in a locked position, you should start seated in a chair and just put your feet on a machine. In this basic position on a pivotal style platform, I would also add decrease the distance between your feet. So we're going to pretend this is the first time you're on a machine. Do not stand with your feet as wide as possible. As I spoke on the earlier question, the wider you stand, the more movement or the more impact that you're going to subject your body to. By standing closer to the center, you're reducing the amount of movement, more like a shuffle or a walk across the floor versus a jog. On a pivotal style platform, 3 frequency ranges. Regardless of what speed or level your platform offers, the language of speed on a vibration machine is hertz. How many times per second we're being moved on this surface. The really slow speeds, many of you are starting at a slow speed. I don't want you starting at a slow speed. Bring it up to a mid or a higher speed, a mid frequency. I am on a hypervibe and I'm moving my frequency from 5 to 11 hertz. On the mid frequencies, as I said earlier, it's a little bit smoother. You could stand here as a spot treatment for 30 seconds to a minute as needed throughout the course of the day, simply to promote circulation and lymphatic movement. One variation, because we have hip and back issues, and many of you have raised that with me, instead of just standing there, I don't recommend doing any one position for 10 minutes. A variation is leaning over at a 45-degree angle, allowing your arms to hang, rest your hands if you have a machine with handle. This is going to target the region of the low back and the hips. And the more you change your position from that basic stance, you will feel the vibration go to different parts of your body. If you are experiencing fatigue, you've got stamina issues, I again encourage short, more frequent sessions as a spot treatment. A spot treatment is not a workout. It is not an exercise. You're not going to lose 70 pounds just standing on the machine for 10 minutes. Now, many of you are going to say, oh, yeah, I've lost weight. Absolutely. You're moving. You're moving lymph. You're doing more with the machine than perhaps you were before. So you may notice some short-term weight loss, some firmness, return, but excessive weight loss is going to equate to doing exercise positions and pushing yourself a little bit. So we're going to step aside from feel good, standing there, that little low back one. You could do that one every hour. If you're sitting lots, you're getting ready to go to the pool, you're coming from a manual massage, use your machine for 2 to 3 minutes pre or post whatever. I recommend the mid frequencies on a pivotal style platform somewhere in the 12 to 14 hertz range for the relaxation and feel good effects. It's going to give you a lot more lymph and circulation than those slower frequencies. If you are working with a high acceleration platform, there are only a few. In the pivotal world, if we're dealing with a Galileo or a Hypervibe, and you have the advantage of those higher frequencies range, anything above 18 to 20, you could do those same positions, keeping the feet close, but you would reduce the amount of time. You're getting more accomplished in those higher frequencies. We're recruiting more muscle fiber, and you don't need to use the machine as long. 30 seconds, maybe a minute max. The higher frequencies are also what I like to use for massage if you have a machine capable of those settings. Massage is sitting on it, putting your calves on it. You are only limited by your imagination and your range of motion. So fitness. What is a fitness session? I want to lose weight. I want to get stronger. I want to run faster. I want to walk faster. I want to get up out of my chair faster. Some of us don't have big goals. We've got goals though. So one of the biggest things that is misunderstood is people think just by standing on the machine, I'm working out. Because that's what the guy at the mall told me to do. So if just standing on the machine is all that you are able to do, that is a starting point. But if you are able to and you want more leg strength, you want to accelerate weight loss and toning, try bending a little bit. Now, you may have a new knee or a bad back. There may be reasons that you are limited in your range of motion. I only want you working within your range of motion. But instead of standing versus bending, just like on the floor, bending the knees is a little bit harder and you're not going to last as long. So on the duration piece, if it is a fitness position, ideally till you're fatigued. And that might be 10 seconds. That might be 30 seconds, and it really depends on how many positions you're doing. So if you are an exercise guru and you are working out regularly and you're doing squats and you're doing lunges and you're doing push-ups and you're doing a variety of position, my general guideline is 30 seconds to a minute per position. So the total time that you're exercising depends on the amount of positions that you're doing. Um, Pushing to fatigue is another very big important point. If you're doing exercise positions and you're just going through the motions or you're following along on a program, you know, your body will adapt to anything over time. So if you want to make big changes, you need to push the body to fatigue to get those strength gains, to get the toning and the weight loss benefits. And you will find that you can push your muscles further on a vibration machine than perhaps you can on the floor because it's less impact, because there is more happening in less time. So if you wanted to start accelerating weight loss, pushing to fatigue and doing a squat till you can't squat no more isn't something I would recommend every hour, like a feel-good treatment. Just like the gym, you would probably work different body parts. If you're an exercise guru, you might have leg day, or you might be doing arm day or core day. I don't do everything every time I'm on the machine. I tend to break my fitness into body parts. I do a little bit of legs every day because I have sciatic and hip issues, and as women, that's kind of how we're built. But when I get into my upper body and my core, I might be doing it 2 to 3 times a week, and it might just be feel good because I've got some shoulder tension. It's not always a big workout. But a very easy place to start, regardless of what platform you are on, would be, starting with like a standing position, just to sort of get you warmed up. So do your feel good piece first, just to get you loose and limber, warm up the joints, make yourself move and feel better, and then just start perfecting one position, the squat. It's going to incorporate the thighs, the glutes, the biggest group of muscles we have. It is going to burn the most calories for us, and it's the one that helps us get up out of the chair. Those are the ones that help us climb the stairs. So the more that you can do to build the glutes and the thighs, a question I had is, what exercises can I do to specifically build those areas? A squat is the simplest of exercises. You can get into variations where we're doing a single leg squat, perhaps a lunge, perhaps we're doing a squat with a ball between our knees. There's a bazillion variations, and it's not a vibration machine thing. Google squat variations. Or if perhaps you're working with a personal trainer and you've got a program of exercises that you've been working on already. Again, a machine is simply an environment that you perform exercise positions in, and it will fatigue you faster with less impact to the rest of the body. So if your goal is weight loss, strengthening, it's about doing a little bit of effort within your own range of motion. And if you're not fatiguing within 30 seconds to a minute, regardless of what settings you're using, your body's getting used to it. Good for you. You've moved up. So if one of the coolest things about a vibration machine, certainly for the fitness as well for the feel good, is you don't need to make up a whole bunch of new positions. It's just work trying to learn something new all the time. You guys have enough on your brain. So 2 or 3 basic positions that you become very good at, and you can just change up your machine settings from week to week. So if this week we're doing all of our squats at 12 or 13 hertz, well, maybe next week we do them at 14 or 15, or we drop it to 10 or 11. Changing some of the factors just within the settings of your machine will keep your body confused, keep those changes progressing in a conservative fashion. The simpler I can keep this, the least amount of positions I can offer, it's going to suit a wider audience, and it's easier to get into the habit, especially if you're not a big exercise guru, and you don't hit the gym regularly. The last thing I want to do is make this look like work. The word workout is as bad as diet. It's just demotivating. So think of this as your spot treatment, your lifestyle management tool. Use it for the reasons of the benefits I outlined. You want that circulation, you want that lymph. But if you do want fitness gains, you're going to need to progress to fitness type positions as you are able. If medically, for certain reasons, your range of motion does not allow, start with the feel good stuff and progress to the fitness once you start moving and feeling better. If you're using a vertical style platform, the amplitude or the distance that you're moving up and down is not controlled with the position of your feet like it is with a pivotal platform. Most vertical platforms have a fixed setting. So it doesn't matter where you put your feet, you're getting the same amount of movement. I would recommend distributing them evenly. I wouldn't be standing all on one side or halfway. Distribute yourself evenly on the platform so as it's pushing you, it's not going off in a different direction. Hip width apart, ideally on a vertical platform, unless you're doing a wide squat or something specific. We do not walk across the floor with our feet wider than our hips. So work within hip width apart max for your distance. If you do have on your vertical style platform an optional high, low, or an intensity button, that will change the intensity and how much you're moving. So if you're doing something like a squat or fitness positions and you do have an optional higher amplitude, try and bring the amplitude up on your fitness positions. You're going to get a harder hit. It's going to work those muscles a little bit harder. Frequency ranges on a vertical style platform, typically 30 to 40, maybe 45 are your fitness and exercise. Anything above that, it's too quick. The muscles can't keep up. There's kind of this threshold, in the frequency ranges, regardless of machine, where the muscles are engaged and then they get to a certain point where, it's just a relaxation effect. So on a vertical platform, the higher frequencies are your massage, your relaxation positions. Whereas on a pivotal style platform, it's those mid to lower frequencies. The higher frequencies on a pivotal platform, you will fatigue faster. On a higher setting on your vertical platform, you're getting a bigger muscle contraction, so you will fatigue faster as well. Position, perfect that squat. Draw that core in. You should be hanging on for stability, not for dear life. If you are not in balance on your platform and you were to let go and fall off your machine, your body's cheating. So hang on for stability, not for dear life. And if you're feeling you just can't squat anymore, stand up and go a little longer just for the lymph. Where everybody starts and progresses, just like going to that gym or working with a therapist, is going to vary for everyone. It is not about a separate therapy for lipedema or Durkheim's disease. This is an activity. It is an environment that makes floor exercises easier and gives you more benefit. So it makes exercise possible for many of you. And any of the combination machines, if you're dealing with a sonic or a spiral, there's different movements. You're not dealing with the higher intensity that the pivotal and the vertical high settings will offer you. If you do find that you're prone to dizziness or vertigo, which is a common thing with those multi-directional machines, same lesson, try and keep those knees a little bit bent. And how often can I use a machine? I don't know that I've completely addressed that. When a doctor or a trainer asks me, well, how often can so-and-so use their machine? It really depends on what you're doing on it. I would say, how often are you allowed to go for a walk? If you're just getting up and going to the fridge and the bathroom, or, you're maybe taking your dog for a little bit of a walk around, I wouldn't put a limit. It depends on how much you're able to walk. If it's fitness and that walk is 10K up a hill and you're completely broke at the end of it, you would probably only do something like that once a day. So how often can I use a machine? Use it as often as you need it. If you're feeling sluggish, if you're feeling swollen, if you're feeling grumpy and you just want to feel better, a minute or two as a spot treatment, whatever feels good to you. Experiment, play within your own range of motion. It's when you get into fitness, working out, I want a specific exercise because I'm training for something, it gets a little bit more complicated. And if you don't exercise regularly, fatigue and technique isn't necessarily something that we're very good at. So keeping it simple, perfecting one or two basic exercises is your best recipe for success. How long? Again, if it's just a feel-good thing, I want your machine to last for a very, very long time. I don't want you to overuse it. I don't want to say that you can use it all the time, 24/7, but you could. I've got clients using it 4 or 5 times a day for chronic pain, or they're dealing with recovery and they're stuck sitting too often. If it's fitness again, and you're pushing to fatigue and you're truly putting effort into it, probably once a day per body part, and keep those durations to maybe 30 seconds to 1 minute per position. I will post in the comments today a very basic standing routine. Doesn't matter what kind of machine you're using. I recommend 30 seconds to a minute per position. If you have a machine and you're not sure what your settings are, or you've been going really, really long, or feel like you haven't been going long enough, feel free to message me personally for some inquiries, and know that I do offer one-on-one training at a reduced rate for the fat disorders group. I charge $40 US for a 1-hour call if that's something that you're interested in. If you are looking for a vibration platform, I work with a lot of different machines. I certainly have preference based on machines' capabilities, relationships with some of the suppliers out there that I've had, and some companies have been around longer than others. Don't get caught up in the hype. Very, very few vibration machines are whole body vibration companies. There's a lot of company making machines and selling machines, but very few provide infrastructure, training, and know very much about the science. So if you're looking for a machine recommendation, I do have a few brands that I recommend over others depending on the price point you're looking for. And I do have some discount offers available through a few of the manufacturers that I've aligned with. So if you are looking for a machine and you're kind of on the fence which way to go, let me know what you've tried, what you've got in your area. If you're looking for a one-on-one routine, please feel free to reach out. If I leave you with anything today, I want you to experiment. I don't want you to be afraid of this thing. If you overdo it, the worst you're going to feel is a little bit over-exercised. One of the things that came up through a few ladies being encouraged by me to get back on their machines is intermittent bruising. You know, you're a crowd that is, you know, boosting circulation and lymph, and you bruise easily. And when we supercharge your circulation, you may notice a little bit of, you know, effect to that, some slight bruising, but it will dissipate. It's usually more related to going for too long with your feet too wide or the intensity too high if it's a vertical platform. So reduce the intensity, reduce the duration, and do it more frequently. I think you'll notice a vast improvement on that front. And I hope I haven't been too general. The big thing is keep it simple, keep it short, and build from there. I appreciate all the comments that have contributed today, and I invite more that maybe I have not addressed in today's very simple session.